Hey there. Hi. Uh, if we're all here, how you doing? I'm Ben. I'm Ben Stiller, and I wanted to welcome everybody to this special Giving Tuesday briefing. Thank you for joining us. I'm a UNHCR Goodwill ambassador, and first of all, I hope everybody's staying safe and doing okay wherever you are. Um, I know it's a tough time and a strange time for everyone, and I appreciate you joining us. And we're here to discuss the coronavirus pandemic and how it's impacting refugees around the world and what UNHCR is doing on the ground. And today I'm joined by Dr. Ann Burton, who's the chief of UNHCR's Global Public Health Operation, who's in Geneva, and Anne-Marie Gray, who's the executive director and CEO of USA for UNHCR. So I'm going to turn it over to Anne-Marie for a brief introduction.
Thank you, Ben, and thank you, Anne, for joining us today. I know that we have donors and supporters from every corner of the U.S. joining today. We have some people that are also calling in from overseas. And I want to thank each and every one of you for joining us on this call today. Thank you for caring about the well-being of refugees and for being on this call to understand what's happening on the ground in the midst of this pandemic. Before our call today, I was chatting with Ben about how much our lives have changed from where they were just a few weeks ago. And we were both saying, unfortunately, what hasn't changed is conflict, violence, and persecution, the causes of refugees. Globally, there are more than 70 million refugees, displaced people, and asylum seekers in UNHCR's care. Many of these people live in camped and crowded conditions. Many have underlying health conditions with limited access to sanitation and medical care, and the majority of these people live in developing countries with weak healthcare systems that are ill-prepared for this global pandemic. While there have been no known cases of COVID-19 outbreaks in refugee camps or settlements at this stage, most of us consider it only a matter of time. A global pandemic requires a global response that includes refugees. The only way we can protect ourselves and our fellow global citizens from this virus is to work together to slow it down. We must ensure that refugee communities everywhere are also included in our prevention and protection plans. This means we need to look beyond our country, the US, and work together and maintain our commitment to refugee communities around the world. Today, we have a unique opportunity to hear firsthand how UNHCR is addressing the COVID crisis and why standing with refugees is so important, now more than ever. A big thank you to everyone who submitted questions in advance of today's call. We've taken all of your questions on board and tried to format them as best we can into our program today. So let's get started. And I'm going to put the first question to you. Can you start off by describing what's happening globally with the spread of COVID-19 and how refugees and the displaced populations we serve have been impacted?
Thank you, Anne-Marie, and thanks to USA for UNHCR for giving me the opportunity to brief on UNHCR's COVID-19 response for Giving Tuesday. COVID-19 is present, as you've seen, in some 200 countries or territories with more than 3 million people who have been affected worldwide. It's been very, very sobering to watch this first unfolding in higher income countries that have much stronger health system capacity, as well as much stronger social safety nets. We have been seeing cases in refugees and certainly in refugee hosting countries, but as you point out, we've not yet seen the large outbreaks that we may yet see. So though this is a public health emergency, the effects that we are seeing are far-reaching. Governments are taking necessary measures to limit the spread of COVID-19, including limiting freedom of movement. Border closures are in place in many countries. We've all been subject to this. But the impact of these measures, particularly on refugees and other displaced, is very severe. These measures have further heightened protection risks for refugees and other persons of concern. They've impacted access to safety, access to services, and also for those seeking asylum. For example, in Syria, UNHCR was supporting around 450 community centres, which also provided child-friendly spaces, women's safe spaces, that provided outreach, psychosocial support, gender-based violence, community health. These have now been closed due to the measures that have been taken there. So you can imagine this is Syria already a very, very difficult environment that has just become so much more challenging. So the impact of these measures is affecting all segments of society, but particularly the poorest and the most vulnerable, including refugees. Many refugees work in the informal labour market. Many have lost their jobs, they've lost their livelihoods. We've seen an increase in intimate partner violence, in psychological distress associated with the confinement, isolation, loss of income. And we've also received reports of more and more families sinking further into debt. For example, the main weekly market in Liberia for refugees, both for sales and for purchases, was closed, depriving refugees and host community of their main source of income and food supply. Lastly, we are also seeing some of our operations are also reporting a rise in xenophobia and resentments expressed towards refugees and internally displaced, which is often fueled by poor quality journalism and misinformation. So while COVID-19 is primarily a public health crisis, the secondary effects, including the socio-economic consequences, will have a deep and long-lasting impact.
Thank you, Anne. Now, you've had more than 18 years experience leading international health programming in conflict-affected, areas of the world with displaced families in Asia, East Africa, and the Middle East. You've personally worked through the Ebola crisis and other health crises. How is UNHCR responding to the coronavirus pandemic? And what lessons are you carrying from your past experience?
Thanks, Anne-Marie. So firstly, in terms of the steps that we've taken to respond to coronavirus, so UNHCR has been advocating and supporting national preparedness plans to try and get refugees and other displaced integrated into those plans as much as possible as part of a coordinated UN country effort. We're not just asking governments to include refugees. As much as possible, our support is also going to those host governments, so that benefits both refugees and host community. For example, in Lebanon, which is a country hosting more than 1 million refugees, so nearly 1/4 of their population, UNHCR is supporting the government's hospital response capacity to both treat refugee patients as well as Lebanese. We've also been purchasing supplies, particularly personal protective equipment for our partner health staff, medicines, medical supplies, medical equipment for case management. For example, in Burkina Faso, we supported local health authorities and other partners with the provision of masks, hand sanitizers, medicines, and medical supplies. very importantly, we have been improving water, sanitation and hygiene, particularly in health facilities, in transit centres, reception centres and collective shelters, where large numbers of people may be temporarily housed. We are strengthening communication with communities. We've adapted materials to suit the local cultural needs as well as the local linguistic needs. And importantly, we've scaled up two-way means of communication so that the messages aren't just one way. So we're able to talk to refugees through hotlines, through community outreach, through web-based platforms. For example, in the Middle East, UNHCR's call center and partner call centres since the March lockdown have received over 350,000 calls from refugees and other displaced. We've also been preparing isolation and quarantine facilities in selected camps and settlements. We are training and equipping healthcare workers so that they're trained to be able to recognise COVID, to be able to start case management, and also in proper infection prevention and control. One area that we're doing a lot of work in, and I'll come to the reason why when I talk about how we've learned from previous outbreaks, is adapting health service provision so that to avoid overcrowding in health services, so that people aren't at risk of acquiring COVID when they actually come to seek treatment. So we've been recommending 2 to 3 months supply of medicines for example, people with mental health problems, with HIV and TB, to reduce the need for them to come to the clinic, and also doing as much as possible follow-up via telephone. We've also been in the non-health area, where of course staying and delivering. As much as possible, we are trying to provide other critical services for refugees. We're continuing to register refugees as much as possible, but using remote means rather than person to person. We've really scaled up cash assistance globally, which is a critical modality. Refugees, where we can, the most vulnerable refugees have received 2 to 3 months cash grants in advance, which is very, very useful for them to be able to buy food, soap, water, or to pay their rent in event of a lockdown. And lastly, we're also supporting schools to remain open where health conditions permit, and also to reduce the risk of the spread of COVID at schools by improving wash and health services and information campaigns. So maybe just very briefly, I will just allude to some of the lessons that we've learned from past outbreaks.
Right.
Firstly, to have a response that is aligned with and in support of the national plan. So we advocate for inclusion of refugees into national health systems and plans. As you pointed out, communicable diseases can only be controlled with an integrated and inclusive approach. Secondly, multi-sectoral action is key. And with UNHCR, a coordinated response to an outbreak brings together specialists in public health, in water, sanitation, camp coordination, shelter, and site planning. Third, and this relates to the point that I made before, third, it's vital to ensure the continuity of essential services, particularly health services, because often during an outbreak, people don't come to the clinics, or those clinics are overwhelmed. And so people are often at risk of dying from other, or of getting more sick from other conditions not relating to the outbreak. Fourth, epidemics have demonstrated the importance of involving communities in preparedness and response planning from the start. This assures that we can counter misinformation, we can address their unique concerns, and can ensure that appropriate measures that are taken respect our social and cultural practices. Thank you.
And thanks for that. Like, I know that many UNHCR workers, including yourself, are now working from home, working remotely. What are some of the key challenges you face in trying to coordinate this global operation from where you sit in Geneva?
Thanks, Anne-Marie. I think the main challenges, you alluded to some of these in your opening statement. I think firstly, as I said, we've been watching this unfold in many higher income countries and seeing that the health systems have become overwhelmed very, very quickly, and also seeing the large numbers of people dying. So the fact that many refugees are hosted in low to middle income countries where the capacity of the health system to manage an outbreak like this is very, very variable. So we do expect a larger proportion of people that may become ill and unfortunately die, just due to the level of care that is available in many of the countries that are hosting refugees. And we cannot build up these systems of care very, very quickly. This takes years. So this is extremely challenging. We are trying to do what we can. Another challenge, just like for many countries, is procuring personal protective equipment. So the masks and the gowns and the gloves that are so critical for healthcare workers to be able to provide the care that they need, but making sure that they stay healthy themselves. There's a global shortage. Many countries that are manufacturing, for example, masks, are not allowing these items to be exported because they wish to keep them for their own communities.
That's a real issue here. It was the first request I had from UNHCR was, can you get us masks, gowns, and gloves? And I'm like, no. So this truly is a global challenge.
Yes. And then and third, once we do get them, actually getting them to the country as well. Firstly, the flights have there's a marked reduction in the numbers of flights. And then one of the other challenges, as I said, we haven't seen any large outbreaks in refugee situations, but just humanitarian access. If we did have an outbreak, we would normally be wanting to rely on surge support to be able to fly people in to manage this. But with the flight restrictions and many of the organizations that we might use, for example, to be able to rapidly set up a field hospital are based in Europe, and because they're health workers, the countries are actually not letting them leave at the moment. Mm-hmm. So this is also where trying to look at as much as possible what capacity we have locally. But if there is a large-scale outbreak that is affecting large parts of a country that's hosting refugees, we know that it is going to be very, very difficult to manage. And then lastly, the restrictions that have been brought in by governments are disproportionately affecting the poorest, who have the least secure livelihood options and are dependent on daily labour. So we're very, very concerned about the medium to long-term impact of COVID on refugee livelihoods and the economic impact of refugee hosting countries, which will, of course, have a knock-on effect to refugees as well.
Right. I'm going to do a call out to UPS Foundation, who are significant supporters of our work and are providing and right now negotiating how their air capacity can be used to help us in the establishment of health centers. So yeah, it's great. And there are many, many ways in which people can assist, and corporations as well. Ben, I'm going to turn to you and say, throughout your time as a UNHCR Goodwill Ambassador, you've had the opportunity to meet firsthand with refugees where they're at, be it Guatemala, Jordan, and I know you've traveled to Lebanon, and you've really very directly experienced the challenges that refugees face in a normal situation. Can you share with us a little bit about how you came to be involved with UNHCR and what you've seen on the ground?
Yeah. So in 2016, I was watching on television when this influx of refugees were coming into Europe from Northern Africa, and there were a lot of boats that were coming over, and people were dying trying to get over and get to safety. And I was watching it, and I saw a friend of mine who is an actor on the beach helping these people, and it really, for me, was sort of a wake-up call to this is a huge issue that's going on. And I honestly, I felt a little bit disconnected from it, and watching it on television. It was that feeling you have when you're seeing people who are experiencing something that's very dire, and you're you don't know what to do about it. So I was in Berlin and doing some press for a movie, and reached out to UNHCR to see if I could meet some refugees who were there, because there were a lot coming into Germany at that time. And I had a chance to meet with a bunch of families, and it was, for me, it was really eye-opening, because in my mind, the idea of a refugee is, it almost becomes objectified. This person, it's not even a person. It's this, sort of idea of somebody kind of wandering out in the world, trying, homeless, or, and somehow I think we have this sort of idea of what that is not the reality. The reality is that refugees are human beings, people just like us, who, through no fault of their own, were displaced from their home due to war, violence, persecution, and had no choice but to leave to find safety for their family. And these are really the most vulnerable people. And there's, literally, I don't know, something close to 70 million displaced people in the world. I mean, 70 million, it's a, huge number. So getting a chance to meet some of these families and connect with them, I really humanized it for me. And so I wanted to keep on connecting and hopefully be able to help, tell these stories to people, so they could see that, that these are people just like us who really just want to get home. I mean, most refugees are just trying to get back to their home, but sometimes it's impossible due to the fact that, if they're from Syria, a country where there's war going on, it doesn't exist, or it's not safe to go back. So I've had a chance to meet with some really amazing people in Jordan. Almost half of these refugees are children, and talking to these kids. I met a family in Amman, Jordan, where this boy Khalil was working because his father couldn't work, and he had, I think, 4 or 5 brothers and sisters, and they were living in a very small apartment, and he was working as a mechanic 12, 13 hours a day, and he was, I don't know, 13 years othink And
yeah, it's just heartbreaking when you see that, isn't it?
Yeah, and it's heartbreaking. And I also saw the resolve in this kid. And I said, I think I said something like, you're a really strong boy. And he said, "I'm not a boy, I'm a man." And he said, kind of proudly. And I also felt like, it's also, it's too bad that he has to become a man at such a young age to have to deal with that. And in Lebanon, I met a family with an 8-year-old boy, this boy Yezen, who's like the cutest kid in the world, and had a twin sister, and he was out selling vegetables on the street because he had to help support his family. And at one point, his father thought about even selling a kidney to support the family. I mean, like really tough stories. And you realize that, these people are in a very tough situation because they, a lot of times that they don't have the opportunity to work because they're not allowed to work in a lot of host countries. In Central America, it's a different issue, that the families fleeing gang violence, but just as harrowing stories. I went to a shelter for unaccompanied children, kids who had lost their parents, and many had been, sexually abused and beaten. And these kids were just beautiful young kids who, just wanted to have just live their lives, and in the places that, where this is going on, the access to help for these families is so important. That's really what UNHCR is about. And
when you think about, like, on top of what you've seen and the hardship that refugees experience, you've seen that. I think, the comment that you made about they just want to go home. I think whenever I travel to the field, doesn't matter who I meet, that is the desire of every single refugee, is all they want to do is go back to where they originally came from. And that's usually not a possibility. And I think the other thing you hit on that was that really resonated for me is refugees, they're willing to stand on their own 2 feet. They're proud. We want to ensure our programming provides dignity and it's a helping hand, yes, but I'm just struck. It doesn't matter if I'm in Ozrock, people were just desperate for work, not for the money side of it, but just to feel that they're contributing to their own community.
Yeah, for sure. And that's really one of the hardest things about being in that situation, is that your life is totally put on hold. Your families in Ozrock, in this camp you're talking about outside of Amman in Jordan, maybe, 30 or 40,000 people there at the time. And families were living basically where all they can do is just sort of get through the day. Luckily, they have access to food and water, but the community center at that place was a very important gathering place, because it's a chance for people to be creative, to engage in some type of work until they're able to go on with their lives. And I think also that's something that's a misconception about resettlement with refugees. When people think about refugees coming into other countries, first of all, these people are mostly fleeing for their lives when they're coming into another country, and they're risking their life to get to safety. But the resettlement programs run by UNHCR are, it's a very small percentage of refugees in the world who actually get resettled. I think it's maybe a couple percent. And of those, who get resettled in countries like the United States, those extremely vetted families and people who come here have only contributed to our economy and to their
country.
To the country, and contributed literally billions of dollars in tax revenue. So it's really a positive thing. And also, I just remind people that that's like, we're a country, and many countries in the West, we're countries made up of immigrants and refugees. That's who we are. And so that's, I'm proud of our country's tradition of always of welcoming them, and I hope that continues as it was. But I would say in helping these people right now, it's such a tough time, because in addition to everything they're dealing with, obviously we're dealing with all this too right now. But just in those camps where people are living in close quarters, just having access to soap and water to stay clean can be challenging, and the social distancing aspect is can be almost impossible. So it just adds on to already challenging situations that these people are facing.
Thanks for that.
Yeah.
I think one really important note to share with everyone on the call today is the critical role that we've tried to highlight for you, that refugees play in camps and settlements to combat the spread of the virus, but to also take care of themselves and their own communities. Ben, when you were in Ozrock camp in Jordan, you met with Syrian refugees who were working in the camp as community volunteer health workers. Can you share a little bit about what you saw and why their work is especially important now?
Yeah, like I was saying, there's probably about 30 or 35,000 people in that camp, and that's a lot of people. And the medical situation there is, as you would imagine, is there. It's they're stretched to the limit. There's only, I think, a couple of ambulances in the whole camp.
And then Ozrock is also like 25 miles from the town. The camp is about 25 miles from the town. So it's not as if you've got, there's not a clinic or a hospital right outside the camp gates.
Yeah, it's in the middle of the desert. It's pretty barren out there. But actually, incredible spirit of the people there too. And yeah, the volunteers I talked to, there were about 30 volunteers who were Syrian refugees themselves, who were working with the medical staff to go out and do outreach to the different refugees and family by family, and help educate them in terms of hygiene, and basically kind of making house calls and engaging with them. And since they were refugees themselves, usually from Syria also, they were able to connect with them on that level, which I think allowed for better engagement. And, I think right now, this kind of thing, being able to have that outreach to make sure that people are getting access to what they need, being educated about the best practices to stay healthy and safe is, very, very important right now. So that's something that, also all these people that you meet, both volunteers and people who work for UNHCR, it's an international community where people go there. It's a calling for them. I'm so impressed by the people that I've met who are so dedicated, and they'll go to one area for maybe a year and then somewhere else in a different part of the globe for another year. And
Anne's one of those.
What's that?
Anne is one of those people.
Yeah, Anne. I mean, it's incredible. I mean, there's a guy named James who I met when I was in Guatemala, who I think is now in Mexico, who's just an amazing, worker and ambassador for UNHCR, and he's just tireless, and he connects on a personal level with all these people. And so those people right now are putting themselves out there too in harm's way because of being on the front lines the way that all of our medical workers and first responders are. So I'm really grateful to them, and I just want to acknowledge them because they do amazing work.
Yeah, thanks for that, Ben. I think there are a couple of things there that I'm going to unpack a little bit, because I think they're absolute cornerstones to UNHCR's approach, and that is it's always about inclusion of refugees in the development of any planning or programming, inclusion of the national governments, of course, because ultimately they're the ones that are responsible for the people within their remit, and inclusion of a host community. That we can't do this work at any level if we're not supporting the communities that are actually hosting refugees. So thanks so much for sharing that. I was in Bangladesh just a little less than 2 months ago, near Cox's Bazar, and I had an opportunity to meet with several refugee community healthcare workers. The camp I was in is the largest refugee settlement. Coronavirus was already evident in Asia. We were really wondering whether we should do this trip or not. It was just starting to pick up in Iran and Italy. But even at that early stage, when we got to Doha and then on to Dhaka and then landed in Cox's Bazar, it was really clear that there was a health crisis upon us. They were taking temperatures as we got off this really tiny plane. I'm going to say this wrong, the Katapalong camp is really quite unique. It was a beautiful piece of land, part of a wild elephant, not sanctuary, but an area that the wild elephants would take this transit through. And the government of Bangladesh, following the crises in Myanmar, and the Rohingya started to come across the border, they quickly developed this into the area that was going to house refugees. And it became an extremely dense, I've never been anywhere that was as densely populated. It's a very, very dense kind of city now of over almost 1 million people. It's built on land that was immediately deforested for firewood. It's an area that's now prone to floods and landslides during a monsoon season, which is like now. You know, on a good day, this is a really, really tough place to live and work. I have never experienced so many people living in such a small place. I make these trips to places like Cox's Bazar to see how our donors' funds are being used and to find new programs and projects that require their support. You know, and I can say together we built wells, we put in water networks, we planted thousands of trees and rolled out clean energy stoves to thousands of refugee households to reduce the environmental impact. Our donors have built shelters and health clinics, and they've put children into school and in the classroom for the very first time. Many of these Rohingya children had never had access to education. I'm really concerned about when I was there thinking about the oncoming pandemic. It was so clear that social distancing is an absolute luxury in that situation. I'm so concerned that the progress that we've made can be erased by something like COVID-19 really, really quickly. And, you know, I can really see that UNHCR and the Rohingya community and the government of Bangladesh are doing everything to ensure that doesn't happen. But what really impressed me were these young women I met, and that was a team of Rohingya community health workers. These women are the frontline healthcare providers in their community. They're rolling out the hand washing programs. They were ramping up soap distribution. You know, what I didn't see, as we've already discussed, was any masks or gloves, at least not at a community level. We've seen Rohingya men that were building with UNHCR support, isolation facilities for the health clinics that we'd visited. You know, I'm so struck by how proud these young women and men were for the contributions that they are making in their own communities.
Yeah, that's amazing.
Yeah.
I mean, and when you see it, you know, in person, I think you know, I kind of wish when I go on these trips, I wish that everybody could take one of these trips just to get a chance to connect with these people, because while it can be really sometimes daunting to think about, and when, you know, the bigger situation, when you meet the human beings and the people who are getting through this, it can be really inspiring, you know, because both for the people, the families who are staying together and working through this time, and the people who are working on the front lines, and the people who are helping themselves too. And I also would say we had a Zoom last week, like a bunch of the Goodwill ambassadors with Filippo Grandi, our UN High Commissioner, and who was sort of giving us a briefing on, you know, what was going on and what his challenges are. And he's someone who basically spends, as you both know, all of his time traveling from, you know, country to country, crisis to crisis, almost all the time, meeting with the people who are working at UNHCR, the people who, the refugees themselves, and the heads of governments, to work to help and solve these problems, and which can be, you know, an incredibly challenging thing, as you could imagine. And one of the things that he was saying is that right now with this crisis, you know, some of the issues that are coming up are what you're talking about, these women who are on the front lines. You know, there is, you know, unfortunately, when there are crises like this, there's, you know, increasing violence against women. You know, and the people who are the most vulnerable in these situations, refugees, are already vulnerable, but, you know, the idea of women and children and minorities, you know, LGBT community and people with disabilities, and all of these, you know, communities and people who are who, you know, are supported, need the support, you know, in times like this, it can be the toughest on them.
Yeah.
And so I think it's important to remember that this kind of work and what UNHCR is doing is really going towards supporting programs and local NGOs that we will work in partnership with to help those groups too.
Yeah, no, thanks you for that. You know, Anne, I described a little bit about what I had seen in Bangladesh, and I've certainly experienced in Greece and in Uganda and all the places that I've traveled. But when you look at something like Bangladesh and Cox's Bazar, you know, the camps I'm speaking of, you know, what do you see are the biggest challenges for UNHCR?
Yeah, thanks, Anne Marie, and also thanks to Ben as well for giving us your experiences. For Bangladesh in particular, and other situations like this, but I must admit Bangladesh is a major challenge, and it has been a focus of ours from the beginning, not only because the virus first appeared in Asia, and we knew that if it was going to hit somewhere, that the situation there was very, very high risk. I think when you look, it's the challenges of also the national health system capacity there is not as strong. It's already hosted in southern Bangladesh in an area that's extremely dense. So already the services for the host community, the government is struggling to meet the services for its own community, let alone the needs of nearly 1 million refugees, as you pointed out. So what UNHCR has been doing and working with partners there has been to try to support the National Health Service as much as possible, including higher levels of care, but also, as you pointed out, building isolation facilities in the camp and being able to expand the clinical services in the camp as well. The other major challenge that you pointed out is the density of the camps there, and being able to maintain the physical distancing that's recommended in prevention for COVID. It's extremely challenging. It doesn't mean that we can't do anything, though. There are some things that we can do. We can, for example, take measures to reduce crowding when people are coming for distributions, or when they're going to for example, to the clinic, and making sure that as much as possible we're avoiding large crowds, and we're changing the way that we actually provide assistance services to reduce that risk. The other challenge that you pointed out is one of the key prevention measures, hand washing, when people don't have access to piped water. We're also used to having access to piped water, but the water in some parts of the camp is scarce, and so it's very much a precious commodity. So telling people to wash their hands frequently or advising people to wash their hands when it's not readily available. Mm-hmm. So these are some of the challenges that we are facing, and I think as well, just in general, the concerns about the relationships when the going gets tough. Refugees and we see this with migrants as well, are often scapegoated, and because there's competition for scarce resources, and so this is another challenge that we're seeing in many situations like this, when you really have refugees and hosts living side by side in very, very constrained circumstances.
Yeah, I think unfortunately we're seeing that in our own country. Some of us are lucky enough to at least have the potential of returning to some form of returning to work. We're seeing restaurants in some part and shops in some parts of the world open up. What's your I don't want to say prediction, but how do you plan for something like COVID in the current environment, where the focus is very much on what's happening in the West? What's your planning cycle look like, or what are the milestones that you think we should be aware of as we talk about COVID in relation to the refugee communities that you serve?
Yeah. I think we're looking at this in two phases. So the first is the containment phase, where we are really trying to do what we can to prevent and prepare for outbreaks or for cases and manage those as best we can. But we're very well aware, and we've already started planning for what are going to be the medium and the longer term. And indeed, we've already started to see it. Governments, when restrictions are placed, we can work from home, but many people in the informal sector and those that are dependent on daily wages, they cannot. And so we're certainly seeing the impact. So we're definitely getting prepared for the long haul. We're doing what we can to improve the health and the water and sanitation and the shelter to reduce crowding. But the long-term impact that we are expecting, or the medium to long-term, is on livelihoods and and on food security, as well as mental health. So what we're doing, we're trying to have a balanced approach where we are working to both prevent and contain COVID in refugee hosting areas through public health, but also needing to plan for the longer term. So we're working with WFP, working on developing joint strategies to meet refugees' basic needs, to at least try to get them through this phase now, trying to target as much as possible the most vulnerable, because we cannot meet the needs of everybody. So really trying to target the most vulnerable, and then looking at trying to strengthen livelihoods and also access to national social protection systems as well, but supporting those national systems.
I know the original appeal went out and it kind of looked at the period of March until December 2020. There is another, what do we want to say, an add-on to that appeal that will be happening on Thursday. But is the planning cycle looking beyond 2020?
So the appeal, you're right. So the appeal is up until the end of this year, in terms of not so much in terms of planning, but what we feel are the needs and what and what resources we would need to be able to meet those needs between now and the end of the year. But UNHCR more and more now is moving towards multi-year planning cycles. I think this is being done at country level as well as here in Geneva. The reason for doing that is to try to move away from the short-term humanitarian planning cycles.
I think we'll all agree it doesn't look like this virus is going to be paying too much attention to the 2020 calendar.
No, exactly.
You're going to need support into 2021.
Yes, exactly.
Yeah.
So we are definitely preparing for the long haul. Yes.
Yeah. Thank you. Ben, you've been a tireless advocate for refugees, including testifying before Congress. The mind boggles about the phone call with all of the Goodwill ambassadors and Filippo Grande last week. What a call!
I think it was like the biggest Zoom, most international Zoom I've ever been on.
Yeah, you guys have all kind of taken to social media. You're encouraging people to wash their hands. I'm seeing hand washing competitions. But you in particular have encouraged Americans to join you in standing with refugees. What message do you have for the supporters that are watching and listening to us today?
Well, I think, I think the message is that, we all have a role to play in this. As what I was saying a little bit earlier, as Americans, I think that's, part of who we are as a country, and have always been and have a great tradition of that. And when I had a chance to go to Capitol Hill last year and talk to people in Congress, they were, for the most part, I think everybody wants to help. I think people want to be a part of the solution and want to come together. And I think, that's one of the biggest things, is just really standing with refugees and, in terms of just, putting yourself out there as someone who wants to connect with people in the world and help. And I think we all want to help, and you see examples of that all over the place in this country. And as I was saying before, also, it's it's a fact that when refugees come, there's so many amazing success stories and people who are part of the fabric of this country, who come from a refugee background. And there's a friend of mine named Ahmed Bader, who's a student at Wesleyan University, who's written a new book. It's coming out. He works with us, and
he's a fabulous guy.
Yeah, amazing young man. And he's very much about empowering refugees to have their own voice. And this book that he has coming out is going to be refugees in their own voice, and taking ownership of their own experience, because these are people, these are human beings who have so much to contribute and have contributed. So I think getting that message out and standing with refugees is a very important thing. And being a part of something like this, a part of this call, and being able to look for ways that you can help in any way is, that's, I think that's a big part of it. And I'm very encouraged whenever I go out in the world and talk about it or talk to people about it, because I think that's most people's first instinct is, they want to be helpful. They want to be, and they are welcoming. And I think that's important to remember right now.
I want to thank you for emphasizing the contributions that refugees make in our country and to the world, wherever they are. Every day here at home, I'm reading stories throughout this crisis about resettled refugees that are sewing masks for our frontline workers or delivering groceries for the elderly in their communities and the communities that have welcomed them. We've seen refugees serving as nurses, as doctors, as researchers, and health providers. As you say, refugees are part of who we are and who we are as a country. I'd like to encourage everyone, if you'd like to find some of these stories, or perhaps you have stories to share, please go to our website at unrefugees.org for more stories about how refugees are contributing here at home as well as around the world. And don't we all need some good news stories? So just a plug for our website. We've got time. We are just about to wrap up. We've got about 6 minutes. And I've got two other questions I'd like to, one for you and one for Ben. I'm increasingly concerned about what I'm reading in places like Uganda, Ethiopia, and Venezuela, where on top of the COVID crisis, we are seeing real issues of food insecurity and potential hunger crisis. Can you share a little bit with us about that?
Sure. Thanks, Anne-Marie. I mean, these issues relating to food insecurity, of course, predated COVID, but they have actually been worsened by COVID. Many of these countries have been facing multiple shocks. Countries in conflict with already fragile economies, and then of course we have outbreaks of pests such as the locusts in East
we have
Africa.
Plagues and famine and locusts.
Yes.
Yeah.
And then COVID with the border closures, which has affected access to market, has forced food prices up, has forced the cost of living has gone up, just getting food to countries as well. So these are major problems in many countries that have been, as I said, present for some time, but are actually worsened now. And so, for example, in countries such as Yemen, the curfews have reduced access to markets, availability of fruit and fresh food. In Bangladesh, access to local labour markets as well has been severely impacted. So this is what we're expecting, one of the secondary effects of COVID that we are most concerned about, that is exacerbating many of the underlying problems and with the food chain and trying to meet the food security needs in those countries.
Thank you for that. I just, for all of our supporters on the phone, we are working in very, very close partnership with World Food Program USA. That will be USA for UNHCR and World Food Program USA, specifically looking at how we might work together to mitigate this. So watch this space. It's deeply disheartening to hear that we still have issues such as famine or potential for famine. Or food insecurity in Africa. Ben, on a lighter note, I know that my fellow countrymen and Anne's fellow countrymen, our Goodwill ambassador, Kate Blanchett, recently released what she calls her 7 films of hope in a short video. Hoping that might provide some comfort and inspiration to our supporters in these challenging times. Can we ask you what your film recommendations might be?
Yeah, first of all, I recommend that video because it's a great video. She does also some interviews with film director James Gray, an amazing filmmaker. She talks about his movie The Immigrant, and Kate's, of course, just a brilliant person and actress, and
our Kate.
yeah, she's amazing, and she's very good in this show Mrs. America right now. That's about the women's liberation movement in the 70s, and I just want to say thanks to her because she's been an amazing advocate for this cause. And my recommendation, I had a couple. One of them is a German film called The Lives of Others. That came out about 10 years ago. And it's about an East German Stasi spy who is spying on a creative person that he becomes connected to. And it's a really beautiful story of humanity and people connecting through the barrier of, these political walls that are put up. And I really recommend that movie. And then one I would just recommend that came out last year that I think is just a beautiful, it feels like a classic to me already, is Jojo Rabbit.
Oh, it's
Taika Waititi. It's just brilliant in terms of creating a tone of comedy and emotion and and hope. It's really a story about hope, and I couldn't recommend it more highly.
Thank you for that, Ben, and thank you for all of the work you do on behalf of refugees. That kind of concludes our formal questions. So Ben, I'm going to hand back over to you.
All right. Well, thank you, Anne-Marie, and thank you, Anne, very much. First of all, for sharing with us today, and also for everything you guys are doing on a daily basis. I know from my experience in my short time working with UNHCR how incredibly complicated this work is, just in terms of the logistics of coordinating these programs and getting help to people. And one of the great things about UNHCR is that it has this ability to connect with on a very big scale with a lot of different organizations and coordinate these relief efforts constantly and in a very personal way. And I feel everybody who's doing the work is very personally connected to it. And I just say, this organization and all the organizations that are doing work to try to help refugees need our support right now. And, I think it's really a time for us all to come together. It's a very tough time for us here at home, and especially for the most vulnerable here at home, and also for the most vulnerable all over the world. So, if you're able to, this is us and me asking if you have the ability to make a donation. I think it's a very worthy cause, and that donation goes to helping people who are in real need and in a very coordinated effort where the help gets to them. So also right now, if you do donate, that donation will be matched dollar for dollar. So it's really twice what you'll be giving right now, which is a really wonderful thing. So I just want to say thank you to all of you working at UNHCR, all of you who are part of this call, for taking the time. And thanks for standing with us and standing with refugees. And take care and stay safe. Thank you.
Thank you.
Thank you.
Thanks, Anne. Thanks, Ben.
Thank you.
Stay safe.